Hi, I'm Melissa Vawter, and I'm with Partnership Health Center, and I am the Medical Legal Partnership Coordinator here. And our attorney, Moses.
I'm Moses Okeyo. I am the MLP consulting attorney.
Yeah, thanks for listening today. We're just going to launch into what volunteering with our medical legal partnership looks like. So who is Partnership Health Center? We're Partnership Health Center's medical legal partnership program. Medical legal partnerships integrate legal services into primary care services. So about 20% of what makes us healthy happens within the clinic walls, and the other 80% of our health and well-being is dependent on structural barriers. Adding legal services to healthcare can help address health-harming legal needs such as food stamps, disability, divorce, custody, ADA, and discrimination. I am a paralegal social worker, and I am embedded within the clinic, and Moses is our consulting attorney, and he contracts with Partnership. So Partnership as an organization is a federally qualified health center. We have 7 locations in Missoula and Mineral County. Our main location is in downtown Missoula. We have rural satellite clinics in Superior and Sealy Lake, and 2 school-based health centers at Willard and Lowell Elementary School, as well as a homeless clinic that's co-located at the Poverello Center. We are also going to be opening a site at the Missoula Food Bank and Community Center. Our mission is to promote optimal health and well-being for all through comprehensive, patient-focused, and accessible and equitable care. So PHC provides primary medical, dental, integrated behavioral health care, as well as on-site retail pharmacy. Our care is family-centered medical, and we provide as many services as possible in one location. So in addition to those core medical services, we also offer services such as social work, housing navigation, certified application counselors, and of course the legal services to address some of the community and system level barriers that we know impact health and well-being. PHC also provides care on a sliding scale fee, and we serve anyone who walks through our doors. Some people might have a lot of resources while other people have very few resources, and no one is ever going to be turned down because of inability to pay. Partnerships services are so important because access to healthcare is so important. It's a cornerstone of individual and community health and well-being. As far as what our volunteer experience will entail for students, I'll let Moses answer some of these questions too.
Okay, so the volunteers will help with a wide range of activities. We usually have a case conferencing every week, and the students will participate in that case conferencing meeting, and the students will help Melissa with screening and client intakes, and the students will summarize the cases that we have in preparation to placing them within our network of pro bono attorneys. They will also participate in legal research and also in presentations to educate the patients and other social workers on certain legal issues that we will address.
Yeah, so really our partnership, our overall goal is for lawyers, doctors, social workers, and other staff to work together in that integrated team to share power with Montana's vulnerable population. And our vision is to create a system in which health organizations in our community leverage legal relationships, expertise, and services to, again, address those health-related social needs. It's really an amazing opportunity for a student to take part in a new program at Partnership Health Center and learn more about legal services within a healthcare setting.
Yeah, to add on that, what Melissa is saying, the MLP, Medical Legal Partnership, embeds legal services as part of the care team. So we will be part of the care team, client-facing. Melissa and the team of interns will be client-facing and will deliver legal services as part of healthcare.
Mm-hmm. Yeah, and then as far as requirements for students, we don't have a class level requirement. We will require that there's a compliance training related to HIPAA which will take place at partnership, that training prior to doing volunteer work with us. As far as skills that a student will be practicing when volunteering with us, there's really a wide range of skills that a student gets to practice, such as client interactions, an opportunity to draft legal documents for court, conducting legal research, legal writing, as well as, again, as Moses was saying, taking part in that face-to-face client interaction with intake and interviewing clients. It's also a really great opportunity to work in a team environment to really empower the client.
What is the time commitment for a student volunteer? This could vary. It could be 1 to 3 hours a week. It could be more if needed.
Yeah, and we're offering, as far as students, we can be flexible. There's going to be definitely virtual opportunity, whether that, be Zoom or phone, and then also opportunity for some in-person learning.
There are going to be no costs to the volunteers other than time and some effort, but there's going to be no additional costs.
Mm-hmm. Yeah, and then again, part of the medical legal partnership is we're working on creating a network of pro bono attorneys. And I think too that this is just a really great opportunity for students to already start doing that pro bono work and make connections in the community. As far as, Moses, if you want to talk about why pro bono work is so important and how our MLP is helping to close that justice gap here in Montana.
There really is a need in our community of people who are disempowered through lack of access. And so our pro bono services help with that, in that these patients have nowhere else to turn. And when they come to our clinic, our professionals, the lawyer, the doctor, pharmacist, the social worker, and now Melissa, our pro bono MLP coordinator, we all share our power with them so that they can access their legal rights. And so they receive the civil legal advice and civil legal help they need to break down some of these barriers to access, be it housing, be it access to social security benefits, disability benefits, be it that they're being evicted and they're going to lose their home. We help them to access these rights. So it's an important work, and work that's not being done at all in most of our community. So this is our opportunity to stand in the gap for these people and help share power with them, help give them the education and resources they need to assert their rights.
Yeah. Well, Thank you so much for listening today. We look forward to hearing from you and seeing about giving you an opportunity to volunteer with our medical legal partnership.
Yes, come join us.
Yeah. Thank you.